All right, if it's spring in Detroit, it is Motor City Makeover time. And so with me today are Kaya Robertson, the Deputy District Manager of District 1, and Joshua Amston and Travis Peters, who are an active part of this effort. And we're going to spend most of this briefing asking for the community support. On the 7 weekends, we're going to do Motor City Makeover. And I want to get back to where I want to be focused, which is in the neighborhoods. But before we do that, got a short COVID update for you. We've got some good news. We've been waiting a while for some good news because really since February, everything has gone the wrong direction in the state of Michigan. But in the last week, really 10 days, we saw the number of new cases in Detroit flatten, and now they are steadily declining. So combination of people starting to take this seriously with the masks and social distancing, and I think the vaccination starting to take effect. We're seeing a good trend. New cases the last 10 days, we were at 500 a day. Last couple of days, we've been basically at 300 a day. Want to see this for another week or so. But as you can see before that, we went, really, it goes back to February, pretty much up every single day. So this is really encouraging. Hospitalizations have started to flatten. They haven't started to drop yet, but given the trend of the new cases, I think that's a matter of time, but they've certainly flattened out from the rate of increase. Now, they're flattening at 450 people in the hospital, which is not a good number at all, but certainly a lot less than 1,000 that we had a year ago. So what you are doing as far as committing to the masks and the distancing in the city is starting to take effect, and I'm absolutely convinced that the vaccines are starting to take an effect. Last year, we'll go back, we know how terrible it was. This is the chart of the daily deaths in the city, but it was this same week last year, about the third week in April, at which we started to see the decline. And so the numbers of new cases we're seeing looks like it may be tracking that. We'll find out in the coming weeks if that's true or not true. But as you know from these briefings, when things are bad, I tell you the truth very directly. When things get better, I tell you the truth the same way. Things look like they're getting better. If we can keep doing this, remember what happened last year. By June, we largely had this city opened up. There is no reason this summer we cannot reopen Detroit to the way that we know. We might still be wearing masks for a while, but we can be largely reopened if we can continue with the masking and the vaccines. Now, we know the reality on the vaccines. All across America, vaccines are dropping. I suspect it's the publicity from the Johnson & Johnson pause, but for whatever reason, I've talked to 3 mayors this morning, vaccinations are dropping everywhere. And it's unfortunate here in Detroit because there's no city that relied less on Johnson & Johnson than Detroit. 98% of our vaccines have been Moderna and Pfizer, but we're being affected as well. But it's interesting if you look as of today, the vaccinations by age group, you can see the pattern of what's happening. If you're between 16 and 29 in Detroit, only 10% of our residents have had their first vaccine. If you're between 30 and 64, it goes up to 26%. 65 and older, we've done pretty well. More than half of our residents have been vaccinated. That's not as high as we would like because, as we all know, our elderly population is more at risk for dying. But what this says to us is we have to shift our strategy. The process of calling up, making an appointment, and come in, our seniors bought into that. TCF was jammed. It went phenomenally. As we have gone to the younger group, the desire to make an appointment and drive into TCF has not been the same. And so we are going to now start to shift. If people have made a decision not to get a vaccine, that's one choice. But I want to make sure in the city of Detroit, every single person who wants a vaccine has access. We are going to be the city that has the most open access of any place in America. That's our goal. And I'm going to keep making sure the sites are available so that if you want the vaccine, it is as easy as possible to get. So, starting today, actually it'll take effect tomorrow, but you can go ahead to, in fact it is tomorrow, but starting tomorrow, you can walk in without an appointment. We are moving now to no appointment walk-ins. You can walk into your local drugstore, your grocery store, your clothing store. You would walk in without an appointment. We are going to start to make vaccines available to Detroiters, walk up, no appointment. So there'll be 4 places starting at 9 o'clock tomorrow morning. You can walk in, no appointment. A TCF center, just go up on the roof, take the elevator down a flight. On the east side, now to drive, the Farwell Rec Center, Northwest Activity Center, and the Samaritan Center over on Connor near 94. 9 to 5, Monday through Friday, and we're going to keep doing this. That you can go in without an appointment and walk in. You're out shopping at the Warren and Connor Mall, go over to Samaritan and stop in. You're out in Northwest Detroit, go over to Northwest Activity Center, drop in while you're out doing your other errands. You can walk in and get your vaccine. We also are going to have 4 more options, and these are going to be 2 options, walk-up or appointment, because we still have the call center, the 230-0505, where you can make appointments. But today at Henry Ford and Western in southwest Detroit, on Wednesday, the Brenza Scott Academy on the east side, and on Friday, East English Village Prep High School from 9 to 5. You can either call, make an appointment, or you can just walk up. And this is what we're going to keep saying. You're in the neighborhood. We're going to start to get more and more visible signs out there saying, walk in now, get your vaccine. Saturday, 3 more churches. You can get your appointment ahead of time, or you can walk up. Fellowship Chapel, Second Ebenezer, Greater Grace, these are all 9 to 1. And so you can see where we're trying to go here. You have 2 ways of going at this. If you want to make the appointment at 230-0505, you can go to TCF or 7 other sites. So we've got 8 sites by appointment, and we have 11 sites that you can go to without an appointment. And if you aren't sure, and you happen to be tech savvy, you text your address to 313-217-3732, and you will immediately get a response with the 3 closest locations to you. So if you happen to be out shopping or running errands and you can't remember and you say, where do I want to go, you put in that text number and it will tell you the 3 closest places, and almost certainly you're going to be able to just walk up and get your appointment today. We're going to continue to do things like this to make the appointments as available as possible. I can't go anywhere without getting questions about these vaccines. And so I'm really glad that the Detroit Health Department has set up every day from noon to 1 what they call Power Hour. And you've got a phone number and a Zoom call on the site. You can find them on our website. But you can go on Monday through Friday, noon to 1, any question you want to ask the healthcare providers, any of the latest rumor you heard on Facebook, some neighbor told you this, you want to know about that, they'll give you honest answers. And it's every single day. So this is our role as a city. Give you the best information we can, make that vaccine as available as possible in as many locations and as easy as possible. And that's what we're going to continue to do. And I'm really hopeful that in the coming weeks, we'll continue to see the new cases dropping as they have been recently. Now I want to move on to what we really want to be talking about as we go forward, less and less about COVID and more about what we're doing to rebuild this city. And longtime Detroiters know all about Motor City Makeover. It's a citywide neighborhood cleanup, always starts in May. We go to each of the 7 council districts on a different weekend, so we can focus all of our energies in one area. And we partner with the block clubs and neighborhood association. You can go to motorcitymakeover.org, and you can sign up right now to do that. And here is the schedule, so you can see it. 1st of May, these are all Saturdays. We're in District 1, May 8th, District 2, May 15th, District 3. So you can go right down the list, and your district managers are coordinated with your block clubs or any other group to go to your neighborhood. And what happens during these times is block clubs and neighborhoods that have said for a while, you know, that site is awful, you know, that stretch is awful. This is a time to reach out to your neighbors, bring them all together, and go out and clean up those sites. And it is one of the most enjoyable activities for me as I go out on these Saturdays from site to site and see neighbors cleaning up their own neighborhoods. It has made a huge difference in this city. And this year, Kaya Robertson from the Department of Neighborhoods is going to be leading that effort. And so you've got some stats. I don't know if you can read them, but basically what it says is that we got 50 to 90 tons of debris out of each one of the council districts last year, and last year's was much lower because of COVID. And so 447 tons at 250 different locations. So your neighbors want to get out and do something. You can be outdoors with masks and do this very safely, and I'm confident by May it's going to be even safer than it is right now. So we'd like you to join with the block clubs across the city and take part. And so you go to the MotorCityMakeover.org, and if you're a group, you can register with your group to take a whole area. If you want to be a business and you want to donate, we've got lots of businesses donate trash bags and rakes and dumpsters and the like, you can do that. Or you just want to sign up as an individual and get paired with the group closest to you. You can meet some new neighbors, come out and have a great time. I've never been to one of these that there wasn't all kinds of smiles and enthusiasm in these projects. There's something very special about spending time with your neighbors, making the community stronger. And with that, I'll turn it over to the person leading the effort this year, Kaya Robertson.
Thank you. Good afternoon, everyone. Again, my name is Kaya Robertson. I'm also the Deputy Manager in District 1. And this year, we're really excited about it. You know, last year was my first year as chair, and I got completely inundated with, COVID. And so we're really excited. And much like the other programs that we had to adjust to with COVID, I tried everything to make this program virtual. And through the resiliency of Detroiters, you were the ones who made it happen with that almost 450 tons of debris being removed. So we just want to thank you so much. And again, you can volunteer at MotorCityMakeover.org. I'm not going to say too much. I brought some folks here that we use as partners, and we appreciate so much. This program isn't successful without your partnerships with the community organizations. And so first, one of our top sponsors of in-kind donations partnering with us every weekend last year and committing to doing that again this year is Josh Arnston, the Director of Programs at Motor City Grounds Crew.
Thank you, Kaya. Thank you, Mayor. So Motor City Grounds Crew, the thing that we do best with Kaya and her team in the community during Motor City Makeover is we bring out our community tool trailers. So we fill up these trailers with tools and bring them out to the community organizations and block clubs that we coordinate with Kaya and her team. Anywhere from shovels to wheelbarrows to loppers to push mowers to weed whips. And so it's been great to be able to do that the last 2 or 3 years with her and her team. We've definitely seen a big difference in doing that. And then from that, we opened up a storefront, East Warren Tool Library, where individual homeowners can come and get those tools that they need to help get their properties and lawns and gardens maintained throughout the year. Because it's not just in May that we need to maintain our community and neighborhoods, but it's throughout the year. Kind of go along with Kaya and her team's 365 initiative as well.
Thank you. And just like Josh mentioned, we have changed Motor City Makeover from an annual cleanup to encouraging groups to do it all year round, 365. And other opportunities for businesses, small businesses to get involved is new this year as a clean corridor partner, which encourages you to just maintain the outside of your building and exterior as a great appeal. And the other partner that we have here today is Travis Peters. He was a great partner this weekend in our Earth Day cleanups from Green Thumbs.
Great day, great people, citizens of the city of Detroit, distinguished panel. I'm honored to be here and represent District 1. I'm the owner and operator of a urban farm in Detroit, and Motor City Makeover, I believe, is is a great tool and vehicle to help beautify our city. They've been doing it for years. I'm glad to be a part of that. One of the things about blight, a lot of us don't know the scientific and the mental effects of blight. It increases depression. It increases the behaviors that cause violence. Those are some of the things that somewhat in despairing numbers plague our city. So I believe that the Motor City Makeover project, it will help to eradicate the blight, and it will definitely help us and where we're located. We're on the Southfield Service Drive where 160,000 plus vehicles pass daily. And to see litter right next to an urban farm, I don't think that really would stand well with people we want to have access to our food. So we're glad to be on board. I'm positioned to just be a pillar of beautification and just getting our city on the front page of just being that Paris of the Renaissance, or the Paris of the Midwest that we used to be called. Grateful to be here.
Thank you, and thank you so much. And I just wanted to take a second to thank all of our partners. And as we move forward, we encourage you all to wear your mask and stay intentional about your spaces. And we also have the, once you register, you'll be contacted by your district manager for supply pickups. We also will help you schedule a special pickup so that the debris can be removed right away. And thank you.
So you can see Kaya Robertson is doing a great job. And Mr. Peters, I couldn't agree with you more on the blight, and that's why what you're doing is so important. Motor City Makeover is a step in that direction. Of course, we're out with our first 1,300 demolitions on proposal N. The people of the city agree with that. And we're in the middle of 2,000 alley cleanups. And I agree with you. I don't think we know the long-term effects of our children growing up in blight. And we are going to push so hard the next few years to get blight completely removed from the city. And with that, we'll take any questions.
Hi, you all. Two quick ones just today. And Mayor, you touched on it, and just kind of reiterating and welcome anybody's input in regard to, obviously, last year, people had other things on their mind, and people still may be worried about safety this time around too. But just out of curiosity, some insights in regard to what COVID last year impeded in regard to the makeover effort, and hoping, I suppose, more people will be welcoming and embracing getting out and doing so safely this time around, or what you expect in regard to after a year ago.
Well, last year, we were coming off in April, in which we had days where we lost 40 of our neighbors in a single day. The level of paralysis was much higher. I wanted to cancel Motor City Makeover, but we had so many neighborhood groups that insisted on going forward, and so we put in very strict protocols relative to gloves and masks and distancing and the like. And so you had people in small groups spread out over large areas, and I did not hear of a single health incident. So Kaya and the team did a great job. This year, based on the reaction we're getting, I think there's going to be a lot more people out. It's going to be a lot easier, and we'll see what the numbers look like over the next couple of weeks, but I do believe it's going to be a lot safer this year.
Also curious if anybody's just listening on the fly today, tomorrow, whenever, if they want to help, whether it's financial, whether it's materials, what can they best do?
Go to motorcitymakeover.org. The site couldn't be any easier. You want to sign up, you click on the left button. If you're a business and you want to donate, you click on the right button. So motorcitymakeover.org is your home.
Vaccines, before I leave you. It's not your operation, but there was a notice in the Free Press today about Ford Field, 7.3% of the doses at this point to Detroiters. You talked about maybe some confusion with Johnson & Johnson. Now, hopefully, with walk-ups, people may be more enticed. Kind of summarizing, are you disappointed with the take rate, for lack of a better way to ask it, from city residents at all?
I got to tell you, I'm not sure I've ever seen anything as misreported as Ford Field.
Okay.
We never believed for a second Detroiters were going to go to Ford Field. Detroit wasn't really engaged.
Right.
If you were a Detroiter, you could drive into TCF and not leave your car. Whereas at Ford Field, you had to park, get out, go into the football stadium. So we knew when they first opened it, and I strongly supported it, you had huge backlogs of people in the suburbs who could not get access to vaccines. But if you give Detroiters a choice between driving through TCF and staying in your car and parking in a structure and getting out of your car and walk, Detroiters had access to the easier vaccine at TCF. The suburbanites who couldn't get it near home came to Ford Field. It was everybody, the governor, everybody knew from the beginning Ford Field was going to be a predominantly suburban site. Had it been a higher Detroit number, it would have reflected that people didn't want to go to TCF. So Ford Field came out exactly the way I thought. It reduced a huge backlog of people looking for vaccines in the suburbs, which is good for everybody in southeastern Michigan. Those folks are coming into the city every day. But Detroiters, you can drive in TCF and not leave your car and be in and out smoothly, as everybody in the city knows. And if you did want to get out of your car, we've got the churches on Saturday, where you could park in your church parking lot and walk in. So I think Ford Field was just a reflection of Detroiters already had good choices.
But finally then, based on the numbers you shared, 26%, 30 to 60, 44, I'm sorry, 30 to 64, 10%, 16 to 29, and you talk about needing a change in strategy. It's just, what, continuing to pound the message of safety on these vaccines, or are you concerned or a bit disappointed that the take rate isn't larger?
Again, I think you're going to see it nationally right now. The conversation is going to shift nationally to every place in this country. There's going to be appointment slots that aren't filled. I'm going to predict that you're going to see that, if not today, within a few days. So I don't think it's going to be a Detroit issue. I think it's going to be a national issue. My job is to make sure, if you've decided you're not taking it, that's one thing. If you can't get there because you don't have a car, because it's inconvenient, because you couldn't figure out on the computer where to go, my job is to make sure it's as easy as possible for you to get access if you want it. And I think with these 11 walk-up sites, we're now making it easier. And I just, the 20-somethings that are out and around, I'm hoping are more likely to do a spontaneous drop-in to a site. We know so far they have not been inclined to call up and schedule an appointment. But it's important to hold down the spread in this community. So all I can do is make it as accessible as possible. I'm going to make it more accessible than any place else, and hopefully people will make a good decision.
Thank you.
Okay, Mayor, we have a few questions from reporters who are watching remotely. Rod Maloney from Local 4 has got a few questions. Wants to know if we are experiencing any wasted doses due to people not showing up for appointments.
Not that I'm aware of. So if Hakeem Berry were here, he could take you through the process by which they take one of these vials and they draw out 6 doses into a syringe. But they basically draw the number that they're expecting in the next couple hours. Then they draw the number they're expecting in the next couple of hours. So they don't draw them out of the syringe until it's just about ready to be used. And so at the end of the day, every day, this has been true for 4 months now, we may have a half a dozen doses that have been drawn out of the vials, and then we call around or go out on the street and find somebody, and everybody stays till the last dose is used. But it just changes the number of doses you draw from the vial. It doesn't result in any lost vaccines that I'm aware of.
Okay. He also wanted to know what happens when or if the city gets to a place where nobody wants to get a vaccine anymore.
Well, it's going to happen in America at some point. And so my guess is we will ultimately evolve to a flu vaccine kind of situation where anybody can go to their pharmacy or their doctor, or our health clinics always offered flu vaccines. So my guess is it'll always be available. And it's going to be interesting to see a year from now. Nobody knows for sure how long the immunity lasts. We know it lasts 6 months. Does it last a year? Does it last 18 months? We aren't far enough along to know, but I wouldn't be the least bit surprised if a year from now, you're getting a booster shot and it's set up just like the flu shots. But we'll worry about that when the time comes. Right now, we're just going to make vaccines available at as many places as we can, as conveniently as we can, so those who want them can take advantage.
Rod also wants to know, with the governor continuing to ask Washington for more vaccines, do you believe that getting more vaccines will help flatten the curve and have a significant impact?
Again, I think when you see the numbers this week, that may not be the issue it was 2 weeks ago. So I'll wait and see how those numbers play out. But based on what I'm hearing from around the country, I think people calling in for vaccines is starting to drop nationally.
Okay. Ken Coleman from Michigan Advance wants to know if you think whether the low percentage of Detroit residents taking the COVID vaccine, specifically in the ages of 16 to 35, may have anything to do with some in the hip-hop community shunning the virus, and wants to know if we're engaging folks from that community, such as Big Sean, Royce the 5'9", or any others.
And, you know, I'm having a lot of conversations, but I think you will find, if you go to rural areas, that the take rate between 16 and 29-year-olds is no different than it is in the city of Detroit. So I'm not convinced that that's the reason, but you're right. We are reaching out to trusted voices in all age groups, and that'll be a part of our ongoing messaging.
Okay. And last question on a different topic. Eli Newman from WDET was asking about the series of multiple shootings that there were over the weekend and the police-involved shooting from last night. Want to know if you had any thoughts on that.
You know, I mean, the violence in this city is not an acceptable level. At the State of the City speech in early March, I laid out plans for the 36th District Court and Judge McConico, the Circuit Court Judge Kenny, Prosecutor Worthy, the feds, all opening up the judicial process and taking these 2,200 backlogged gun felonies and moving the cases forward. Everybody was poised to do that, and then we hit that spike of COVID, and that paused that. I think it's coming down now, and you've seen some unfortunate cases where people have been released on very low bonds because we have a system that's not working. I'm very hopeful in the next few weeks we're going to see the COVID rate come down, every one of these law enforcement agencies. And every one of these courts is anxious to get back to it. And I would say on the shooting, I just want to commend Chief Craig and the Detroit Police Department. The Detroit Police Department is different. You had an officer-involved shooting last night. We didn't wait 2 or 3 weeks to release a video after we had been badgered into it. Chief Craig came out the next day, and because we were the first department to have a fully integrated dash cam and body cam system, we've had the ability, when these kinds of incidents have come out, to show the public exactly what's happened. And when officers do something wrong, Chief Craig is the first one to say it and deal with it. But as we saw last night, from everything I've seen, I've only seen limited clips, it looked like the officers last night were heroic. You know, they were responding to a multiple shooting when they got attacked themselves. And I just think the city of Detroit is strongly behind the Detroit Police Department. You might not know that from the media coverage of some of these protests. The one thing I hear from Detroiters, every time there's a Detroit Will Breathe story in the media, I hear from everybody, they're not from here. They're not from here. That's what Detroiters are saying. They're not from here. 2/3 of those groups are coming from Ann Arbor and Brighton. And I do think at some point it's important for the media, because Detroiters are getting tired of this being portrayed as a Detroit protest. I think if you're going to report their message, you also ought to report that the people who are saying defund the Detroit police are going home to the suburbs and going to sleep in their own community, and I don't think represent most Detroiters. But I thought Chief Craig and the Detroit Police Department handled the situation with openness and transparency, and you know, we're just really fortunate to have this police chief.
All right, thank you. And with that, there's no more questions.
Thank you.